If you're preparing to sit the AMC MCQ, I'd highly recommend that you stick around for this question. So we have a 28-year-old woman, Gravata 1 Para 0, at 16 weeks and 2 days gestation, who attends for a routine antenatal visit. She is asymptomatic with stable vital signs, and ultrasound shows a live intrauterine pregnancy with growth appropriate for gestation. However, her cervical length has shortened from 33 millimeters at her previous visit to 24 millimeters today. Which of the following is the next step in management? Option A, insert a cervical pessary. So for our case right now, this is the wrong option. So a cervical pessary is basically a silicone ring that can be placed around the cervix. Evidence on its use case is quite mixed, particularly when it comes down to it being used in first line. We often don't use it first line in a case such as the one we have for our patient here, because our patient's asymptomatic. Had our patient been symptomatic or had a previous history of preterm birth, that's when we might consider option A as a first line option. Option B, commence vaginal progesterone. This is the correct option. So as per guidelines, vaginal progesterone is currently the first line for an asymptomatic pregnancy where the cervical length has become less than 25 millimeters. So this fits the criteria of our patient. So it's her first pregnancy. She doesn't have a previous history of any preterms, and her cervical length is now 24 millimeters. So that makes option B the correct option. We'd use the progesterone to support the cervix and essentially stabilize it. Option C, perform an emergency cervical cerclage. This is wrong. So this is essentially using a surgical suture to stabilize the cervix. This is used more for cervical dilation problems. It's often not used in cases such as our patient where it's not complicated and it's her first pregnancy. So that would make option C wrong. Option D, arrange induction of labor at 37 weeks. So this is wrong because at the current stage, we're not planning to induce. This would be more of the focus if we were in the second or third trimester and we were experiencing complications such as gestational diabetes or preeclampsia or hypertension issues and even any sorts of growth restriction. That's when we would plan to arrange for an induction. Not quite the case with our scenario here, so that's why this option is wrong. And our patient is only at 16 weeks, so our current focus right now would be to prevent any sort of preterm labor that might occur, not plan for it. Option E, reassure the patient and repeat the scans at 28 weeks. This is wrong because it's too passive for the current situation. So had it been greater than 25 millimeters, so say if it went from 33 millimeters to 28 millimeters, we could definitely consider reassuring the patient and maybe repeating the scan in a few weeks. Maybe not 12 weeks from the current week. But yeah, in this instance, it's less than the 25 millimeters. And as per guidelines, we would want to commence the vaginal progesterone. So I hope you guys learned something from today's video. Please leave feedback in the comments below, give us a like, and follow the channel for more videos. Thank you guys.